So good evening, I am your student nurse for today, and for today's video, I'll be demonstrating how to assess the head, face, and neck of the patient. But first, allow me to demonstrate the requiring equipments for today's assessment. So we will require a stethoscope, a cup of water, sanitizer, and gloves. Okay, but the first thing we must do is identify our clients, so to ensure that we are dealing with the right clients. And of course, secondly, we must obtain nursing history and do a general survey prior to procedure. And lastly, if there are any curtains, doors, they must be closed to maintain privacy. So before we proceed to the assessment, we must sanitize our hand and we will wear the gloves. So good day, ma'am. I'm your student nurse for today. So ma'am, I'll be asking you some question. Like 2 questions, ma'am.
Sure.
So what is your name po?
Regina,
Your age po?
20.
Thank you, ma'am. So after that, we must explain to the clients the procedure. So ma'am, I'm here to explain the procedure. So ma'am, I'm here in order to perform an assessment on your head, face, and neck to ensure that everything po is normal. And if there are any abnormalities po, you need to take note of that to avoid further complications po. But as assured po, all the findings and documents between me and you are completely confidential po.
Okay.
So, ma'am, I'll be asking you some question po. So, nahilo po ba kayo ngayon?
Hindi naman.
So, any previous of trauma or migraine?
Hindi rin.
So, may masakit po ba sa inyo ngayon?
Wala po.
Wala naman. So, salamat po. So, now we're going to now we are going to the first part of our assessment, which is inspection. The first thing we want to inspect is the head and the face, and for any signs of asymmetry or unequal hair distribution, as well as the size, shapes, and presence of lumps. And of course, finally, we want to inspect or observe for involuntary movements. So, ma'am, I'm going to start by looking at your face and head. Okay. Which means looking at the shape and size of your head, which is normal for your size of person.
Okay.
So now, ma'am, I'm looking for the symmetry face. So, ma'am, it's okay if I touch your face po.
Sure.
So when I'm looking for the symmetry, I'm looking for your eyebrows po, and for your eyes, and of course this line of your mouth. And I think based on my observation, your face po is all symmetry. And that's good po, that's normal. When you observe on your patient face, if there are any dropping that be indicating a stroke, or that possibly indicating there are any problem with their cranial nerve. So now I'm going to palpate my client's head, but before that we must ask permission first. So now I'm going, ma'am, to palpate your head. So I'm required to to touch your head po, ma'am, if it's okay with you, ma'am.
Okay.
It's okay. So the next thing that we need to do is to palpate the skull of our client. And in order to feel any signs of lumps, bumps, and protrusion in the skull. So anything hurt, ma'am?
Hindi naman po.
Dito po, masakit po ba?
Hindi po.
Okay, salamat po. So now we are going to palpate the temporal artery of tenderness of our patient. So we need to ask the permission again. So ma'am, I'm going to palpate your temporal tenderness. So it's okay ma'am if I touch on po?
Yes po.
Oh, salamat. So ma'am, may masakit po ba?
Wala naman.
Okay. Can you, ma'am, can you open your mouth like this? Okay, close ma'am. Smile po ma'am. Okay, may masakit po ba?
Wala
Okay.
naman.
So I observed that on your face there are so wala naman siya di naman nagki-click yung jawline niyo po and no swelling po.
Okay po.
So which is normal po. So for our next assessment is the neck. That's our next assessment. So the first is inspect the neck. We need the occurrence to observe slightly extended for the neck position and symmetry and lump of masses. So ma'am, I'm going to check in your neck po. So can you raise your head na po if it's okay, and I will touch in your trachea.
Sure.
So ma'am, can you raise your head? And so, okay po. So ma'am, I can see that your trachea is the middle line. So that's normal. I didn't see any swelling or bulging. Yes po. And that's normal po. So the next we will expecting the range of motion to the, and we need to ask the patient or the client to turn the head right, left, chin to the shoulder, and of course to touch ear to the shoulder and touch chin to the chest and lift the head to the ceiling. So ma'am, I'll be checking your range motion po. So ma'am, if I say raise your head to the ceiling, you must raise, and if I said to the left, you must do the left. So ma'am, can you raise your head to the ceiling? Okay po, to the floor po. So to the left, sa right po. So can you do this to me ma'am? Sa kabila po. So while doing that po ma'am, you can feel pain po, any pain.
Hindi naman po.
Okay. So, thank you, ma'am. So now, next we need to palpate the trachea. We will place our finger to the sternal notch. So we must feel each side of the notch and palpate and of the trachea rings. So we need to ask permission to our patient when doing this assessment. So ma'am, next I will palpate your trachea po, this. So I will do it po. So it's okay po if you raise your head konti po pataas. So I will touch in your trachea po. Trachea ring po. So okay. I observe na sabi na naman po siya. And yeah, it's normal. So now we will palpate the thyroid gland. And we will locate key landmarks with our hands and fingers and thumb. So ma'am, I will do it po ma'am. Again, it's okay po ma'am. Can you
Okay.
raise po your head, okay? Okay, it's normal po. Wala naman po problema. So now for now next, so now we will place our thumbs on the nape of the client's neck with other fingers on either side of the trachea below the cartilage. So we will go beside the client. Ma'am, can you just wait ma'am, excuse me po, we can just move. Ma'am, okay, thank you po. So now, can you Okay. So for the next, we need to palpate the right lobe using the right fingers while clients swallow. We must offer the client a small water. So ma'am, can you drink a water for me, ma'am? Just a konti lang po, ma'am. So next we need to reverse the technique to palpate the left lobe of the thyroid. So ma'am, can you drink po ulit po? Okay, it's normal. Okay, thank you, ma'am. So, so now we need to osculate an enlarged thyroid gland and place the bed of the stethoscope over the lateral lobes of the thyroid gland. So ask the client to hold his breath. So ma'am, I'm going to osculate your thyroid gland po using my stethoscope. When I say hold your breath, you need to hold, and when I say exhale your breath, you need to exhale. So ma'am, it's okay with you, ma'am?
Sure.
Okay, ma'am, just relax po. So inhale, hold your breath, ma'am. So exhale, inhale po, hold your breath, exhale. So we're doing this po sa kabila po. Inhale, hold your breath, ma'am. Exhale, inhale po, hold your breath, and exhale. So thank you, ma'am. So for the last, we need to palpate the cervical lymph nodes of the following shapes and size and diversion, motility, consistency, and tenderness. So ma'am, it's okay if I touch this spot.
Sure.
May masakit po ba?
Wala naman po.
Okay. It's normal. So, yeah. So ma'am, the last part of your assessment, head and neck, you have any question po? Clarification?
Wala naman po.
Okay po. Everything is normal po, wala naman po problema. So, ma'am, thank you po for your cooperation, and my advice is stay hydrated, eat healthy food, and stay safe.
Thank you po, nurse.
Salamat po. So after that, we must remove our gloves and throw it on the proper places. And after that, we need to sanitize our hands. And that's all.